This recording will go over hemolytic uremic syndrome as well as Wilms tumor. Hemolytic uremic syndrome is a disorder that can lead to acute renal failure in children. Most affected children have an associated prodrome of gastrointestinal symptoms, including bloody diarrhea, which suggests that an infectious gastrointestinal agent may be the cause of hemolytic uremic syndrome. It is thought that the E. coli causes problems for the patient when it attaches itself to the intestinal mucosa and grows and multiplies. From there, the bacteria produce a toxin that damages the endothelial cells of capillary walls, and subsequent inflammatory responses result in occlusion of capillaries. The process is especially significant in renal glomeruli. The occlusion of glomerular vessels decreases filtration, which results in acute renal failure. However, it is important to understand that the vascular process that is seen in hemolytic uremic syndrome can occur in any organ. Anemia results from fragmentation of red blood cells, which are damaged as they try to pass through occluded vessels and are removed from circulation by the spleen. Thrombocytopenia occurs because platelets get trapped within the small vessel. So just to recap, hemolytic uremic syndrome occurs because of E. coli, usually starts out with GI signs and symptoms. What happens is the toxins from that bacterial cause problems with capillaries and can occlude those vessels that are supplying oxygen, nutrient-rich blood to our important organs in the body, including the kidneys. So starts out E. coli, GI disorder, causes problems with vessels, can lead to anemia, thrombocytopenia, and renal insufficiency or acute renal failure. Wilms tumor is the most common renal tumor in children. Although the cause of Wilms tumor is unknown, it is associated with a variety of childhood syndromes and congenital anomalies, including cryptorchidism and hypospadias. Most children are diagnosed between the ages of 2 to 5 years. Wilms tumor arises from the renal parenchyma of the kidney. At the initial diagnosis, the disease is usually local, but metastasis to other organs occasionally occurs. The lungs are the most common site of metastasis. The most common clinical presentation of Wilms tumor is an asymptomatic mobile abdominal mass discovered by the parent or other caregiver while bathing the child or by a primary care provider during a routine physical examination. Additional manifestations include microscopic or gross hematuria, hypertension, abdominal pain, fatigue, anemia, and fever. The tumor mass should not be palpated during the assessment because of the risk of rupturing the protective capsule. Excessive manipulation can cause seeding of the tumor and spread of cancerous cells. The diagnosis is suspected from data in the child's history. Abdominal ultrasound is the initial study done to detect a solid intrarenal mass. Abdominal CT, MRI, X-ray, or chest CT are performed to further evaluate the extent of the disease. A definitive diagnosis is made at the time of surgery on basis of pathological findings or during biopsy, right? Palpation or any pressure on the tumor before surgery must be avoided to prevent possible rupture and spillage of tumor cells into the peritoneum. Treatment of Wilms tumor consists of surgery and chemotherapy alone or in combination with radiation therapy. In most cases, the tumor can be completely removed by surgical resection at the time of diagnosis. During surgery, the surgeon is careful to prevent rupture of the tumor and spillage, which might necessitate more aggressive treatment. The goal of the initial chemotherapy treatments in these children is to reduce the tumor size before definitive surgery, although the Children's Oncology Group now recommends surgery before chemotherapy treatments. All children receiving chemotherapy after the tumor is surgically removed. Radiation therapy is added to the treatment of larger, more extensive tumors or those with an unfavorable histologic classification. Survival rates for children with Wilms tumor are higher than rates for children with many other forms of cancer. The overall survival of children with Wilms tumor is 90%. Survival is higher among those with a more favorable prognosis. Please review the purple nursing care box for nursing care tips for the child with Wilms tumor.